I'm going to talk briefly about the use of a splint in cubital tunnel syndrome. So you'll see I've already spoken about the use of a splint in carpal tunnel syndrome, and the evidence for the splint in cubital tunnel syndrome is also quite strong, like it is for carpal tunnel syndrome. So I've already explained that repetitive flexion of the elbow or prolonged flexion of the elbow can lead to compression of the ulnar nerve in the cubital tunnel. Again, that's around here. And over time, that can lead to swelling and inflammation around the nerve. And like I said, patients will often complain of pain around the elbow region. So the idea of the splint is really to try to alleviate that pressure and thereby maybe allow the nerve to rest and reduce the inflammation. And it has been shown to improve the symptoms of cubital tunnel syndrome. So with an ulnar nerve splint, the arm will be immobilized and it'll be ideally with a slight flexion of about 40 to 50 degrees. Now, obviously, compliance with the splint will be very important in terms of how effective it is. It'll mostly be worn at night, especially if you sleep in a position where your elbow is flexed or if there is external compression on the nerve. But obviously it can be worn during the day if activity allows that. So what goes hand in hand with the use of a splint is activity modification. So obviously, depending on what your job is or how you use your arm during the day, how you modify activity will be very individual. But an example would be if you were on the phone a lot using your hand, you might decide you're going to switch to earphones or a loudspeaker. Or if you are writing for prolonged periods or typing for prolonged periods, to make sure you have something soft that's in between your elbow and the surface. In terms of other activity modification, again, it'll depend on how much you are flexing the elbow and how you can maybe change some of the movements that you were doing. If you notice that you tend to flex it a lot, in times you don't necessarily need to, but you weren't aware that it was leading to compression of the ulnar nerve, that may resolve a lot of the symptoms. But this is definitely a discussion worth having with your healthcare professional. Now, it should also be said that the splint is really indicated for the more mild symptoms of cubital tunnel syndrome. So, for example, if you're having more intermittent tingling in the distribution of the ulnar nerve, or it occurs primarily on or predominantly on elbow flexion, then the splint is probably going to be sufficient to manage your symptoms. However, if you have begun to develop weakness of your hand, then if you haven't already, you should seek a healthcare professional's opinion just to see if you need further investigation. So the splinting in combination with activity modification forms what's referred to as a conservative management of cubital tunnel syndrome. And this should be followed for approximately 3 months in a consistent manner, or as consistent a manner as you can, before deciding whether or not it is of benefit to you.